So many sessions for physiotherapy for this shoulder pain, and the pain is not getting better. Today I will explain why it's not getting better. So the reason behind the recurrence pain is that you are putting the weight, the whole weight on your shoulder, and you are overstimulating your muscle fibers and your ligaments gets unstable. This is an important thing you need to know, that the ligaments are the muscle fibers, you can say the soft tissues that connect your bone to the bone. So this shoulder joint is a very complex structure. It has different ligaments, it has rotator cuff, it has the infraspinatus, supraspinatus, teres minor. There are a lot of muscles. So this complex joint, if you are putting weight in wrong direction, in wrong angle, definitely you are putting the weight on the wrong ligament. So for the laxity, for the stability, you need to focus on your ligaments. You need to put the right weight on your shoulder. And sometimes when the injury happens, you're not giving the right time for the shoulder joint to get it healed properly. We give it just 1 or 2 days to get it healed. We take physiotherapy session, we do a lot of treatments like soft tissue release, we do dry needling for those muscle fibers that are contracted, but we don't give it some rest to get it healed. Every injury, every musculoskeletal injury related to soft tissue needs some time to heal. So for the overall healing of the joint, and especially the sports injuries related to the shoulder joint, we have multiple options. After the rehab, we have the option for PRP, that is the platelet-rich plasma. We take your own blood, we take the healthiest part of that blood, and we inject it back into your injury site on the painful side, and it makes the healing process very fast, and the recovery time gets slower. And then we have the options for therapeutic peptides. These are the natural compounds that are facilitating the body's defense mechanism to play a crucial role in healing and basically the aggravating the time process needed for the recovery. It's not only about the physiotherapy treatment or any alternative medicine like peptides, PRP. It's about the education, that whatever you are doing in your workout, whatever you are doing in gym, do it in a right way. Give some time to injury to get it healed, and then again start your normal routine. Make your joint always mobile. An important thing, always stretch yourself. Always stretch all the muscles around your joint before workout and after workout to avoid the risk of any kind of injury. This is Dr. Fahad. I'm a physiotherapist. Thanks for watching and follow us for more content.